I think one of the most unique products that I was introduced to, it was last year at the IDS meeting in Cologne, Germany, that I was introduced to this product, is a product called GrandTech from VOCO. And GrandTech is one of these products that you're not going to use every day, that you may not even use every week, but I can tell you that when you need to use it, you're going to say, man, I'm happy I bought that product and put it into my armamentarium, because it just is one of those products that fills a void or a need in our system. And basically what it is, it's a resin impregnated glass fiber reinforcement system. So I think all of us have used to reinforce teeth things like Rib-On and possibly use some sort of wire and things like that. The biggest problem we always have with the Rib-Ons and whatnot is the handling. You have to use special gloves. It's shredded when you cut and things like that. Well, what VOCO did is they created this fiber-type system, this bundled parallel glass fiber that's impregnated with a light-cured resin. Each unit is about 55 millimeters long and has a diameter of 2 millimeters, and each strip has a removable protective film to facilitate the ease of handling, so you do not have to use special gloves like you do with Rib-On and some of the other products. Here's how it comes. It comes in this packaging, and here is that 55 millimeter strand of the GrandTech fiber. And again, you're not using this every day, but I'll show you a bunch of cases that I've used this. The nice thing about it is its handling. You can manipulate it with college forceps, hemostats, plastic instruments. It's very easily manipulated and easy to measure as well, and we'll show you that in a few seconds. And you can shorten it with scissors, and it doesn't really shred at all. Once you place it onto the tooth, and I'll show you how we do that, and I'll even show you that in video, you'll see how it really makes sense in the system. So this woman was broken by her mother. She's an 85-year-old woman with Parkinson's, and her mom comes to me in the middle of my day. She says, my mom broke a tooth. And of course, I take a look, she gives me the tooth, and she's avulsed the entire tooth. And this woman has Parkinson's, and of course is not amenable, because of her condition, to any type of long-term care. Now, it's in the middle of my day. We have a busy day, so what do you do in this situation? It's not about aesthetics, necessarily, because her lip's going to cover most of this. She just needs a tooth there. So it's presentable for her. It's something she could work with. So, good thing I had GrandTech sitting in the cabinet. So here's how it comes. We open it up. Here is that foil packaging. You can see here the light strand within the orange packaging. And what we do is, I'm going to go back for a second, but I'm going to measure internally here approximately how long a strand of GrandTech I'm going to want. And then I'm going to go ahead and fold this orange packaging over. And using a piece of dental floss that I measure, or a ruler, I'll overlay that over this orange while I fold this over, and just cut the orange material and the GrandTech fiber inside. So for argument's sake, if this is my cut, and I cut it in a third or in half, while this was folded over, I would save the other piece for future use and use only the piece that I need, and now it's ready to be worked with. Lo and behold, it works great with Futurabond DC and the Grandioso Heavy Flow. The three form a perfect match together, and you can either etch those teeth with phosphoric acid first and then apply the Futurabond DC, or you can go ahead and just use the Futurabond DC. Your bond strength, I think, are improved a little bit with the etch, and very often in a bruxing area, like in a situation like this, if she's a bruxer because she has Parkinson's, she clenches a little bit, I would tend to use etch in this spot and then apply the Futurabond DC. So use phosphoric acid etch for 10 seconds, then the Futurabond DC 20 seconds, air dry, light cure. Apply onto the teeth, buccal, lingual, and proximal, wherever I'm going to use my fiber. And what I do is I begin to take my Grandioso Heavy Flow, and look what you kind of see. This is not cured. I've overlaid this on here, and it's just sitting directly on the teeth, directly exactly where you put it. And that's the beautiful thing about these heavy flow flowables, is exactly where you place them, they will stay. And now what I go ahead and do is I take my GrandTech fiber and I overlay it. This looks like it's on the incisal, but it's on the lingual of these anterior teeth. And I light cure. And now I have that light cure. When I light cure this, it becomes very hard. Those glass resin impregnated fibers becomes very, very hard. So now what happens is I can begin to use this as a mold or a base, if you will, to be building up a tooth out of my Grandioso heavy flow material. And here's the completed case. Now, is it the most aesthetic, gorgeous tooth in the world? I'm not going to say it's the most aesthetic thing, but remember her lip's going to be up here. And her lip's going to be up here covering this tooth, and for this 85-year-old woman, that she can walk out and function and look good all at the same time, be able to smile without having a space in between there and without committing to expensive dentistry, I think I'm doing this patient a tremendous service. Now, the question I get asked all the time when we do this is, well, what do you charge for a case like this? Because it becomes difficult. I will tell you, this did take me about 20 minutes to do, or 25 minutes to do, partly because of the patient's condition. But I would probably charge, and I think it's a fair fee, between $400 and $600 for a procedure like this. Your cost of material is very, very low, and you are doing a tremendous service here for the patient when you're doing something like this. So, and they hold up pretty well. I have not had one of these break on me yet, and I've done a good number of these over the past year. And here's our biggest nightmare. So Kurt comes into my office. I will tell you exactly when this was. This was the day before Christmas Eve at the end of my day. And Kurt says to me, Doc, I broke my front tooth. I need you to get me through the holidays. And we love when they tell us these things, because what does Kurt have here? Kurt has a caries central, non-restorable, plus caries over here on number 8. It's 7:30 at night, the Wednesday or Thursday before Christmas, and I'm going away for my break, and he needs a tooth, and I can't let Kurt go through the holidays without having a tooth in the front. Well, what do you do in this spot? It becomes a very, very tenuous situation. So I'll show you exactly what I did, and here's what I did. Futuribond DC, I placed, I acid etched, of course, first. I placed 2 Grand Tech fibers across for 2 reasons. One, this tooth was severely carious. Number 2, I had a porcelain crown here. I wanted to try to get as much adhesion to the porcelain crown as possible. And I even placed a Grand Tech fiber up and down this way for extra reinforcement, because I was going away for 8 or 9 days. I just didn't want this thing to come out and break. Using the Grandioso Heavy Flow Flowable, we built it all up with our composite, and that's what Kurt looked like going home. So now you say to yourself, is that a service? Did I do this patient a service? What did I just do? I just restored a carious tooth. I restored a carious tooth temporarily to give him something that he could use potentially, and probably not come back to my office, considering what he looked like coming in. And you never know if someone like this is going to come back and see when you make these things look too good from the get-go. But I can tell you he has been back. I actually had to cut this out of his mouth. We saw him about 2 weeks ago. It was rock solid. And the other nice thing that I love about this is he actually had that tooth extracted and an immediate implant placed. Well, all I did was, when it was all said and done, was once this was built up, I created a proximal slice here and a slice here, cutting through the Grand Tech splint and the Grandioso Heavy Flow, extracted the tooth, placed the implant, and then resplinted it back into place. So he was able to walk out with that same temporary. So when you're looking for a use for something like this, and you say to yourself, well, where else can I use a product like this? The answer then becomes that, you can use a product like this also for your single tooth implant temporaries. I think you'll see how it makes sense, how you just need to have this sitting on your shelves in your practice. So when would I use this? I would use this for splinting of teeth before or after periodontal treatment. I would use it to stabilize teeth that could be reinserted after traumatic removal. It can be used internally or externally to close gaps using resin teeth, inside or outside the mouth. It also can be used to reinforce temporaries, as I'll show you that in a few minutes. And the nice thing is it's metal-free. It can be used directly or indirectly. It links chemically with any conventional light-cured composite. It's very, very aesthetic, and you can use it even to reinforce large-span temporary bridges.